I think the pandemic has reminded us how we can't be complacent in health, how we, have to do our 20 seconds hand washing. Even as nurses, you do like your 10-second hand wash. There, I washed my hands, but the pandemic reminded us very quickly that it wasn't good enough.
Yep, big wake-up call.
Yeah, absolutely. Absolutely, huge wake-up call. So that changed the way we started training people as well, and that changed the way, we couldn't do big groups of training for our workforce. We had to look at different ways on how we're going to train them. We had to practice donning and doffing gloves and gowns again because we thought we were doing the right thing when really we weren't. And there were holes in our practice everywhere. So as a workforce, I guess that was really humbling. Yeah. In other sectors of workforce, I feel as if the effects of the pandemic, we're not going to see for another couple of years. So, and I'd be so interested to see the research about this in a couple of years' time. So the pandemic will do one of two things in terms of funding, government funding for degrees, et cetera, for institutes like this and Griffith or the universities. The governments will either increase funding to health, which will aid in any graduates coming into the workforce, or they won't have enough money to do that, and that will impact on the supply of graduates coming into the workforce. Then we have different generations coming into the workforce now because of some have been displaced by COVID. So all the airline industry has been decimated. So we've seen some of those Generation X's, I guess, for want of not putting people into their boxes, changing their profession because they've had to. So we may see some of those coming into the healthcare workforce. We may see some Generation Ys that, for want of a better description, are loyal to and think about the community more so than the Generation X's. So it may be that the pandemic has made them really think about, okay, well, what can I give back to the community? So we may see them come into healthcare, but we don't know that yet for a couple of years' time. So that's the longer term effects of the pandemic on workforce. Then what we saw was resourcing. So all of our supplies, all of our, gloves, gowns, masks, there was a real panic because healthcare providers thought that we wouldn't have enough supply. And that was Australia-wide. And it's really made healthcare providers think, and those that manufacture healthcare resources within the country, how can we have these back at home? So that's been a huge impact. And, we saw rationing within healthcare services of supplies.
Wow.
Yeah, it was very interesting.